The Program of Experience in the Palliative Approach, or PEPA, supports Australia's health workforce to deliver holistic care to people affected by chronic, advanced and life-limiting illness.
When people hear the words palliative care, they often think of care provided in the final weeks or even days before death, but it means so much more than that. PEPA provides education and training through workshops, placements and evidence-based resources.
Since the 2012 Aged Care Expansion Project, PEPA has provided placements for more than 150 workers in aged care. Over 90 palliative approach and aged care workshops have been attended by more than 2,500 participants at various metropolitan, rural and remote areas of Australia.
By completing the PEPA placement, I've gained a better understanding of the residents' experience and that of their families too. I've also had the chance to better understand the symptoms that they're experiencing and what those symptoms might mean.
One of the advantages of the PEPA participant coming out with me doing rounds in residential aged care facilities is that they tend to get a broader exposure to palliative care patients.
The palliative approach to care is about improving the quality of life of older people with chronic illnesses and frailty through addressing their physical needs, their psychosocial needs and their spiritual needs.
Even though I worked in aged care for many years, I had many questions about death and dying that I couldn't answer, and I wanted to make sure that I was giving my residents the best possible care.
I was able to provide education to them that was really relevant to them in their particular facility.
I thoroughly enjoyed being able to work with nurses and physicians and social workers and even nurse practitioners and being able to pick their brains about palliative care. Everyone I came into contact with was friendly and supportive and they all had a wealth of knowledge. Another positive has been being able to bring my knowledge back to my co-workers so that they too are able to care for our residents in the best possible way.
Is really helping people with a life-limiting illness to live well and die peacefully.
Funding is available as a contribution towards backfill, paid to your employer and towards travel and accommodation costs for regional and remote participants. To register for upcoming free palliative approach workshops in your local area and apply for a free PEPA placement, visit pepaeducation.com.